In East Africa, there are high hopes that making better use of research evidence will in turn make the lives of these Nairobi children all the brighter.
I think that, I know that at least in Africa, if we were able to put to use even a quarter of what we know, the lives of our people would be different.
An innovative institution called REACH is currently being created in East Africa to help facilitate relationships between researchers and decision makers.
What is so important about REACH is to say, instead of you being so annoyed with this group because they are not using your research, and you being unhappy because these people are doing their own thing and related to your concerns, let's come together. Let's have a group that looks at the progression from evidence to policy to practice. And this is what's so exciting about this REACH project.
The Regional East African Community Health Policy Initiative, known to its friends as REACH, will soon be based at community headquarters in Arusha, Tanzania. But for now, the Nerve Centre is here at Makerere University in Kampala, Uganda. Nelson Sewankambo is one of the driving forces behind the REACH initiative.
It will act as a clearinghouse where research evidence will be collected from within the region and around the world. Research evidence that is relevant to various important priority health issues.
Those major health priorities will of course include malaria, HIV/AIDS and TB. But REACH will also collect evidence on how to improve health systems in Uganda, Tanzania and Kenya.
This research evidence will be synthesized to sort out what the meaning of this, and then those will be packaged in simple language, brief communications, so that these can be disseminated to the policymakers in the region.
REACH has this brokerage responsibility to ask researchers to communicate effectively in ways that policy people can understand what their findings are and how they can be applied. And for policy people to say, look, we have some issues on which we want some evidence in order to have informed decision making on policy, so that the policy should have an input into research and research into policy.
But in the REACH initiative, the aim is to simplify the information, to synthesize part of it, and put it out in a way that can be assimilated by anyone.
After years of meticulous planning, REACH has won support from leading researchers and policymakers across the 3 countries, including health ministers and their most senior officials.
It's not, for example, our mode of working to say, before we come up with any policy, what does the team of researchers say? Are we on the right track? We have not reached that point. So the moment this REACH program is a reality, anything to do with the policy may have to get some clearance from them. They will now be active players in the policy formulation, recognized by government, not just an interested, isolated, friendly researcher talking to me as a personal friend and then I pick his views.
Using education as a key tool, Uganda has developed an international reputation for dramatically reducing the spread of HIV/AIDS. Yet the virus remains a significant killer both here and across the region. In Kenya, Miriam Were is chair of the National AIDS Control Council and another influential promoter of REACH.
You know, when we are deciding as a council how to prioritize financial allocation, REACH can help us to know what has been the most effective in which parts of the countries or in which part of the world, in which part of East Africa. Because we are a very similar people in East Africa. So if it has worked in Uganda, maybe it would work in Kenya. So we don't have to start all over. So REACH would be very, very important in that.
Around October, November 2002, I was so sick that the relatives were forced to take me back home to die. And even when I was in the vehicle, I didn't know I would live for another 2 or 3 days.
Godfrey is now taking antiretrovirals as part of a study testing the concept of interrupted therapy, potentially a far cheaper and more convenient option, with results likely to be of great interest to REACH.
The result of the study will now empower the researchers, all the policymakers, how best the drug can be used.
The use of evidence is very important, especially in countries like ours where we have limited resources. So if you are poor, actually you need more evidence before you invest, rather than if you are rich. And you need to generate that evidence in the actual setting and feed straight to those who are making decisions.
While REACH will have staff at community headquarters in Arusha, on the edge of the Serengeti, it will also operate from established research institutes inside each country, not conducting research but helping to translate it. At the Kenya Medical Research Institute, Director Davy Koech is another REACH supporter, but he points out that evidence has been informing policy for a long time already.
There was a feeling that nothing like that was going on. While at the Kenya Medical Research Institute itself, we have a whole center of more than 40 scientists trying to look at various pieces of information and data that is being generated, not only from research that's going on in Kemri, but also research that's going on in this country and elsewhere, for us to interpret the data for the purposes of advising the government on how to formulate policies for action. So those things were already going on. So it was not new.
Despite the inevitable turf wars, REACH is now becoming an active player, improving the health of the people of East Africa. And for those elsewhere, REACH looks set to become something of a model for helping decision makers make better informed decisions.
The time is just ripe for this kind of development, and maybe it is the missing link between what we know, which is huge, and the misery of our people. Because most of our diseases, we actually know practically everything that we need to do about to improve them.